Hello and welcome to the Mighty's Facebook Live pages, and we have got pages for you, including chronic pain, chronic illness, chronic warrior, cancer, and their flagship page, the Mighty site. Welcome also to my show. It's called The Pain Cancer Connection. I am really glad that you can join me today. And rather than coming to you live from the Mighty headquarters, as I used to do, I'm being very safe and I'm coming to you live from my home headquarters. And I hope all of you are being safe and doing the same. So my name is Cynthia Toussaint, and I will be your host for this 45-minute segment of the Pain Cancer Connection. I am also the founder and spokesperson at the nonprofit For Grace, where we help women with high-impact, persistent pain. Now, on this show, the Pain Cancer Connection, we examine how pain and cancer can be overlapping diseases. For instance, how chronic pain with all of its inflammation can lead to cancer, and how cancer treatment can and often does lead to chronic pain. And the reason I am fascinated by both of these diseases and how they intersect is personal. I have been a woman in pain for, this week, exactly 38 years. And I just recently went into remission from triple negative breast cancer. So, wow, it's been quite a journey. Okay, before I introduce my really lovely and inspiring guest, I just want to reach out to all of you, the audience at the Mighty. I just love all of you, and I want you to be a part of this show, and I want this to be interactive, and I want to learn from each other. That's what this is all about. And so please don't be shy. If you send in your questions and your comments, I look forward to taking them throughout the show. Okay. Yay. Hello, everybody. It's great to see comments and hellos from people. My guest today, Tom Norris, is a really lovely and inspiring man. He's really, truly amazing. And we can all learn a lot from Tom. And I think we're all going to relate to him as I do. I have a lot to say about this man before I introduce him. Daily, Tom Norris deals with chronic back, leg, and neck pain, which started in 1988 after radiation treatment for testicular cancer. Tom served in the United States Air Force for 23 years as a lieutenant colonel before being medically retired due to his pain. His specialty in the service, and I find this very interesting, was problem solver or go-to person for unsolvable problems. Very interesting for a man with high impact pain. Tom has been a member and facilitator for the American Chronic Pain Association for over 25 years, and he currently facilitates weekly Zoom self-help chronic pain support groups, and he often contributes to media and conferences focusing on the patient aspect of dealing with chronic pain. So all that being said, welcome Tom Norris to the Pain Cancer Connection. Are you there?
I am. Thank you.
Thank you.
Thank you, Cynthia. This is a real privilege. Thank you.
And back at you. Such a privilege to be able to interview you today, Tom. And I'm just really looking forward to having you tell your important story, and also to just finding similarities. And we're all one, right? We're all so similar. So I'm
Definitely.
looking forward to learning from you today. So no pressure. Can we just jump right into your story, and can you tell me about your life before you were diagnosed with cancer?
Sure. I was, as you said, I was a career officer in the United States Air Force, and I absolutely loved my job. I was married to my job, and of course, this is before Marianne. I was able to travel all over the world. I grew from an introvert to an extrovert, because I realized with exposure to all the maintenance people and the situations I had that I really love people. And, as you said, I really became the go-to person for problem solving. I had a fantastic time meeting people, going places, challenging jobs. The job I had just before cancer was 4 years at the Pentagon. Which, as a captain, I had a ball. I seemed to have more connections than most people. And then I got to Saudi Arabia as a military advisor. And within a year, I found my cancer.
Wow. So, did you ever, I'm curious, did you ever find a problem that you couldn't solve?
I don't think so. I mean, you got to be creative and you got to be on top of things. But what I found out is the key to solving problems was knowing people and what their strengths were. And in the military, whether it was an airplane problem or a personal problem or a scheduling problem, working with people seemed to be the key. And I was very blessed in that because I'd started out as an introvert and then became an extrovert because I wanted to survive.
Wow. So I'm glad you became an extrovert.
Me
It's
too.
very,
Me too.
it's very nice. So then you said, I found cancer. I believe you said that. So
Yeah.
when you were diagnosed with cancer, Tom, what treatments did you choose to undergo and what was your prognosis?
As a preface to answering that, I have to tell you that I found my cancer, which at that time was bigger than a baseball. I had testicular cancer, and I was in a shower, and I found the tumor. I was in Saudi Arabia, and I was reticent to let anybody touch me. And I was also handling two uh, estates. Both my parents had died separately before my cancer. So I found the tumor in June and finally got to the States and found a doctor in November. So by that time, the tumor had gotten to a small basketball. The pain was obvious. I really was having a hard time. So when I got to I saw a civilian doctor first, and he panicked. The funny part is that he made me drop my pants to see the tumor, and then he brought everybody into the office to see the size of the tumor, which was embarrassing. By the time I got to Walter Reed, I really had no choice. I had to have surgery, which they did immediately. And at that time, the only treatment was the orchiectomy, which is removal of the testicle, and 30 days of radiation. What I found out later is that even if I had found a doctor in Saudi, the treatment would have been a safe. So I really had no options.
So your no options were you had to do surgery and you had to do radiation in order to survive.
That's correct.
And did the prognosis look good if you had done if you did the
Well,
treatments?
This is hard to say, but the doctors kind of lacked a good bedside manner.
Uh-huh.
In fact, they told me that I was probably going to die in the hospital.
That gave me goosebumps. I'm so sorry. We're told such horrible things by doctors. I'm forever flabbergasted. I'm just really sorry. And this was in
1984.
Oh, this is in 1984. Okay. I did my reading wrong. Okay. Wow. So did any oncologist or any doctor mention to you that as a result of this surgery and radiation, chronic pain might be an outcome?
Absolutely not. I mean, back at that point in time, I think the Air Force didn't believe in chronic pain. So I had no idea this would happen.
Wow. Wow. So no doctor mentioned to you that chronic pain might be a side effect, an outcome of your cancer care. Tom, tell me about your pain. When did it start and what is it like?
My pain started about 2 years after the radiation treatment. It started out as a pain in my left hip, and it progressively involved my lower abdomen and my left leg and the base of my spine. And over the years, it's gotten progressively worse. Every day it seems to get worse. Now I hurt from the base of my skull to my tailbone, lower abdomen, both hips, and left leg. It really precludes my being able to be active, to walk very far, to even sit for a long time. I've described my pain as being on fire, and that really pertains for the left leg, the lower abdomen, and the back, and it'll come through my chest when the pain in the back is really bad. So it's like a volcano erupting. Yeah, I also get stabbing and shooting pains. It's like I get hit by lightning bolts times if I don't move correctly or move slowly. Does that give you an idea?
It gives me a good idea, and you're really good at describing your pain. I've never heard it described like a volcano erupting. That's a new one. Very good. Okay, so very well described. So in the crisis phase, I always call it, when we've, in the early years of your chronic pain, like for me, I was a singer, dancer, actor. I'd just gotten a part on the TV show Fame. And suddenly I had a disease, complex regional pain syndrome, that started with a ballet injury. I mean, I lost everything. And it's so chaotic, and you can't figure out what's going on. And for me, the doctors were saying I was crazy, and I couldn't dance anymore. I couldn't do anything anymore. My family, my mother's incredible, but my siblings left me. My friends were moving on with their lives. My wonderful partner, John, stayed with me. We've been together 2 years. We were 21 years old, but my career was over, and it affected every part of my life. Even my relationship with John, because it was so hard, negatively. And I'm wondering, during those really chaotic years in the beginning, how you dealt with your chronic pain and the accompanying, if you're like me, the isolation and the depression. How did you deal with that in the early years?
Well, it was rough. The initial thing for me was being medically retired from the military and losing my career. And at that point in time, Marianne and I had been married maybe 2 years, and I was still identifying with the military. I mean, I spent 23 years, and for them to tell me at the hearing that I'd never be able to do anything, that quote, you'll never be good for anything or anybody anymore.
How dare they?
Yeah, it was pretty devastating, but at that point in time, I progressed to the point of being pretty much aware of life and its intricacies. So at the tribunal, when they said I'd never be able to do anything, I said, hide and watch. And so, when we medically retired, and Marianne had done research, we found doctors. We went through 20 doctors trying to find somebody who could offer me some hope. And at that point in time, they couldn't. And it was hard, but my faith, which came from my grandmother, and Marianne's faith and our partnership got me through it. It was like we're not going to knuckle under. So I immediately started finding things to do. I went and learned to teach adults how to read. And that turned into a 5-year program where I worked with after-school kids, at-risk kids in an after-school program. I did 35 kids from the neighborhood for 5 years, teaching them everything from survival skills to, working with homework to how to wash behind their ears, how to use deodorant, the whole schmear. So I kept myself busy. There were times when I was bedridden, it was it wasn't easy. For some reason, the medication affected me to the point where I got depressed, and Marianne had a solution for it. The 10 years that I was bedridden, she would have parties in the house, and
Wow.
I'd be in bed with in my PJs, and our friends would come up, and I'd have 7 to 8 people on the bed at the same time, and it was difficult, but it's the teamwork and our love for each other that got us through it.
Wow, that's an amazing love story. I was bedridden for 10 years too, and I couldn't speak for
Oh,
5 years. Yeah, sort of very similar story. But we didn't have friends like that. I mean, people were afraid, I mean, people were so afraid of it. It sounds like you have some amazing friends. You certainly have an amazing wife.
oh, trust me, I know I have an amazing wife. I'm one of the luckiest people in the world. Her friends.
She's lucky too. People
Oh,
always
yeah.
tell me I'm so lucky to have John. I'm like, he's lucky too. And she's very lucky too, Tom.
Yeah. It was amazing for me. In the military, you make temporary friends, as I call them, little F friends. You're at one base and then you go and, everybody has their separate lives. But here in LA, with Marianne's friends in the business, I found true friends, and it's been very different than any experience I ever had. Our friends now I could go to at a moment's notice and they would help. They're just amazing, lovely people.
Amazing. And we have that now, but I think at the time, we moved from the Bay Area where we grew up. We had been working like in places like Las Vegas and Reno and South Africa, places like that. And then we had to leave show business. And I think when we moved to LA, I think that people actually seemed like ballerinas were afraid of me, almost like I was contagious,
Yep.
So that was kind of the problem with the friendships in the beginning. So did you not experience anything like that?
Well, the military friends kind of left me alone, although a few of them have come back.
Nice.
To be blunt, I think I'm a typical male. I didn't have friends. I had acquaintances.
Yeah.
But Marianne's friends and the people in Hollywood threw me for a loop because they stood by.
Wow.
So,
impressive.
Initially it was just a continuation of the loneliness that I'd experienced all my life.
So with your depression, I mean, I dealt with so many years of depression, and it got to the point where for years and years, I thought about suicide, and because I had to have a way out, and I didn't see a future for myself, and I thought that I was ruining John's life, and there's so much despair, and I realized, like, looking back, I never attempted suicide, but there were 2 days where I thought that I would, and I got out, I got myself going, and I'm going to get up and I'm going to go to the party and whatever it was. But I'm wondering if you ever got that low.
Actually, I did. There was one day that Marianne and I both remember where she came to the side of the bed and she was kind of miserable. She says, "Is there anything I can do for you?" And I said, "Kill me."
Oh, God.
And, we're both Catholic, so, we're kind of not in that vein, but it was low, but with Marianne's support and in my I love to read, so I always had books. When I was going through the worst time, Marianne was on a series called what was the name of it? She was on a series. I saw her all the time. It was the daytime, and I actually saw her when she wasn't there in the house. So I had her there
nice.
all the time. And
right.
it really, I guess it's the love, the companionship, the partnership that we shared, and my faith and my ideas about life that just kept me going. I mean, sure, the pain the pain has been horrible. I mean, there are days now when it's horrible, but I don't even talk about it anymore. It's just after 23 years of pain, or what? No, 32 years of pain.
You forgot about those extra years, Tom. That's a
Yeah,
lot of
that's
years.
it. I mean, it really has become something that's part of my life, and I go, well, I can use it to benefit others, and therefore make myself feel worthwhile, so that no matter how degraded I get, I'm still productive. And I think that goes back to the military, because I feel like I need to be productive. There has to be a reason for me to have this pain, if that makes sense.
It makes complete sense, and I totally identify with it. Okay, so really, it's like you're answering for me. Thank you. Saying it in words that I wouldn't think to say.
Sure.
I'm curious, if sort of going into science fiction here, if you could go back to when you got diagnosed with cancer, knowing everything that you know now about pain, would you choose to undergo the same treatments that you did?
Again, I really had no choice. So if I went back, I think I'd still be in that situation. But that goes to the point where now, as crazy as it sounds, I look at the gift aspect of the pain. Pain has allowed me to slow down, and appreciate life, appreciate Marianne, appreciate what I can do. Initially, I had 3 heart attacks on the pain, from the pain, and and now have diabetes thanks to the medications. But it's all part of the package. And now I go, okay, how can I use this? How can I use what has happened to me in this journey to be of service to my fellow man?
That's wonderful. So when the U.S. I'm still stuck on when the U.S. Army discharged you and said
Air Force.
you
Air
would
Force.
never be able to do anything.
Yep.
What did that do to your self-esteem? I mean, you're like saying basically it crashed your hope. I mean, I'm using my own words.
Sure.
And your identity.
Well, yeah. Well, it was stealing my identity, my whole purpose of life. Because I was a type A, or I am a type A person, where production was my reward.
I can relate with that.
Yeah, as I said, my immediate reaction, even though I was crying on the inside when they said that, is hide and watch, because I meant that I was going to go and prove them wrong. And that's a lesson I learned from my mother and my father, that you just don't quit.
Okay, that makes sense.
Does that answer?
Yeah, it does answer. It makes me angry. What they said makes me angry. I love what you did. At For Grace, we talk to women in pain mostly. I don't get to talk with a lot of men in pain. And we women in pain are told that our pain is in our head. We're crazy.
Yeah.
We're told for the first 13 and a half years of my illness, I was told that I was horrible things, but it was all about how I was making it up. And I'm wondering if you were told that, if that was part of your care.
Well, the military, as I said, really didn't seem to believe that such thing as chronic pain was existing. It took them, I think it was 4 years, to actually determine what was going on. And they say after they saw the scar tissue from the radiation, they went, oh, we're never going to be able to help him. And so therefore they started the thing of getting rid of me. But in those 4 years, I faced the thing of, it's all in your head. All you need to do is stay in bed for 3 months. And I did that 4 times in 4 different hospitals. I had everybody saying, just take a pill. And there's no reason you can't do it. well, things just got worse. I was able to do my job while I was at Edwards as a squadron commander and then a deputy chief for maintenance production. But then I got to San Bernardino, and I was on part of the inspector general team. So we traveled all over the world, and it got so I couldn't do my job. And people actually began to see the pain behavior, and which is I don't like, but that's exactly what it was. But when they started to see that and realize that I really was in pain, there started to be a shift toward, okay, yeah, maybe he's got something. But they really didn't put any support behind it until they saw the scar tissue.
Wow. So the scar tissue made you an honest man, I guess.
Yeah,
Isn't
but
that sad?
Yeah, say again?
Isn't that sad?
It's very sad, and I just pray that people don't have to go through it now. I mean, I'm hoping there's been a quantum shift in appreciation for pain. The one thing that really threw me was when they were boarding me. I did a tribunal. Mary Ann and I did a tribunal for the medical about. What I found out from other people is that, for example, a woman, an airman is what they call them at that point in time, who had similar pain, was offered 30% disability. 30% of disability is nothing. And Mary Ann and I had to fight, hire a lawyer and everything else to get 100% disability. And what I realized is the military, besides at that point being a little chauvinistic, even though we worked on that, they still didn't believe people had pain. So I haven't worked with the VA recently, but I know that the research I've done and the studies I've done and the funding requests I've done is that there is a lot of research going on, particularly with migraines for people coming back from the wars.
That's exciting.
Yep, time's changing.
Times are changing. I like that, Tom. I want to read a quote from the January 2020 issue of National Geographic. And it says, Tom Norris, who lives in a Los Angeles suburb, spoke to me from a long cushion bench, which allowed him to go from sitting to lying flat on his back. A tall and genial man, he's become adept at wearing a mask of serenity to hide his pain. I never saw him wince. When his agony is especially intense, his wife of 31 years, Mary Ann, says she can tell by a certain stillness she sees in his eyes. Tom, can you tell me what's behind the stillness?
Agony, some frustration, the loss of ability can be very devastating. Mainly it's agony because I can ride through most of the pain, but when it really gets out of control, all my mechanisms or control mechanisms fall by the wayside. And I really, that, Eudigit, came to the house, and so he's very personable, and I appreciate being mentioned in the article. But I learned basically that nobody wants to see somebody in agony. And so I keep my agony and my pain hidden. And what you didn't put in the article was that my pain really gets bad, I go to bed, I disappear. And I do the same thing with parties. To further describe what I'm going through, I'd have to be able to draw you a picture of the pain. It just, it gets to the point where I feel like I'm wrestling a lion that's full of fire, or a dragon that's breathing fire on me. It's exhausting. And, does that answer your question? I'm sorry.
Yeah, it's a very, very, very good answer. Tell me about your faith. How does your faith help you cope? And did you ever doubt your faith?
Actually, no. My faith was started by my grandmother. By her reading me Bible stories as a kid. She was Episcopalian, and she led her life as a Christian. I know it's little C or capital C, but I think my faith began to solidify when I lost both my parents within 35 days. I was kind of struck, and this is prior to cancer. My grandmother lost her faith after my mother died, and even though handling the two estates was almost as hard as going through cancer, I was able to come to grips with there is a higher power, that she's in control. She, whatever. The different aspects, and that we were given. I feel like we were given opportunities to meet and defeat the devil, if you will. Cancer came along, and it was a little touch and go at times. But I did a whole lot of praying while I was in the hospital after for the radiation treatment, and everything just seemed to solidify. Since then, I became Catholic, and my faith is now, I think, the core of my existence. One of the things I did, I think, that really worked for me was, they say if you can give your pain or your troubles to the Lord, it'll work. Well, for a long time, I could visualize the hands of God outstretched. And I worked on mentally putting my trouble, putting my pain in those hands. But I'd always snatch it back and say, this is mine. Here it is, but it's back to when I finally learned to leave it in his hands, I acquired a sense of peace that still permeates me. Faith is a personal journey, and for me, I don't doubt. It's part of what I learned as a child was that we've been given gifts, and I go, okay, it's my task to use those gifts that I figure are God-given to work on any situation. And that's what I do. Whether it's positive imaging or praying or meditation or whatever, my faith is an integral part in everything I do.
Wow. You mentioned, you didn't mention art therapy. You mentioned that something about you could only describe your pain if you drew it. And I'm wondering about your other coping skills. And is art therapy one of them? What are other things that you do that help you cope with the pain?
I do a lot of reading. I love to work on computers. I collect comic books, so I've got a comic. Oh yeah, and I'm still a kid. I like being involved with people. I still try. Oh yeah. I try to, I solve, well, for instance, Mary Ann you always come up with a computer problem, and she'll spend hours trying to fix it, and I'll in and go, okay, here, click, it's done. Just staying busy. I do a whole lot of counseling. I do one-on-one listening is what I call it, empathetic listening, or empathetic listening. I managed to keep my office very messy, so that's an ongoing project.
Good for you.
Hey,
I'm
but
impressed. You also
yeah,
travel.
yeah, and that's one of the greatest things. People say, "How in the hell can you travel with chronic pain?" And I go, "Well, I could hurt here, or I
Yeah.
could hurt on the Greek Isles, or I can hurt in Machu Picchu, or I can hurt in Paris, or hurt in
I love
England."
it.
And really, that has become, something for both of us. And we've come up with a schedule, so we know that, for instance, after I travel, I need a day to rest to get my strength and my wits back. Then I'll do one thing the next day. The next day I'll be off. And the days I'm off, Marianne can either stay with me or she can go off and do her own sightseeing. And it works. I mean, we did Peru that way and had a ball.
I love it. So John and I love to travel too, and I use a wheelchair. And I was wondering before this interview, like John will never ask for help. I'll be like, yeah, thank you, please, please. And I'm wondering, Marianne being the caregiver and the woman, does she ask for help? How does she do it with you in the wheelchair? Because it's so hard with John. For John.
Well, our first trip was 30 days in Italy. And I have vivid memories of Marianne carrying my wheelchair all the time. I mean, up and down to the trains and everything else.
John's nodding.
and I still use the wheelchair. Yeah. So there's always that. But yeah, Marianne will ask for help. She'll say, you're gonna have to wheel yourself. I can't do it. I'm too tired. And it's really an indicator for me of the partnership where we're both aware of each other's limitations, and we try to work together to solve it all.
I love it. You're so eager and you're so brave, and you just have such a positive outlook, and I just love it all, Tom. I am curious, when did you decide to become an advocate for other people with pain? What sparked that in you?
Well, I have to give a nurse named Betty the credit for the initial thing. Now, I was in a in-house chronic pain management clinic, and I was doing pretty well. When I first walked in, I couldn't walk at all. I was in a wheelchair, and that clinic helped me to the point where within 3 weeks I was able to walk and come home and cook dinner. But Betty, and I don't know her last name, but I will sing her praises forever, said, you ought to get in contact with the American Chronic Pain Association. So I did. And when I got out, I joined my first support group. And within 3 months, I was facilitating, and I haven't stopped. It was just, I get so much strength and reinforcement from seeing people who have chronic pain like I do, sharing their experiences, but mainly the thing is just listening, and just to appreciate those people. And I think I've done 5 support groups, different support groups, and now I'm doing one, as we said, on Zoom, and the other one on the telephone.
So if somebody watching this show needs a support group, because I hear this all the time, I need a support group. Where's the support group? And I live here in Rhode Island or wherever it is, and or Europe or Australia. And can you do a shameless plug for your support group, for your Zoom support group, Tom?
Sure. Let me start with I do a support group on Thursday afternoons through an organization called Covia, or Well Connected, and that's for the elderly. So you have to be 65 or older, and it's a phone in. And I get, as I said, people from all over the United States. For the world, I do. The best thing for somebody to do is to find a support group through the American Chronic Pain Association, or they'll tell you that I'm doing Zoom, and about half a dozen other people are doing Zoom. So anybody's welcome to join my Zoom support calls, support groups. We have people from Thailand, and today I picked up somebody else from Texas. But the more the merrier. The more we can get everybody going to the point where we're looking for quality of life and supporting each other and empathetic listening. The more the merrier. Is
I
that a good
love
plug?
that. So you all heard it here. Now I know where to send everybody because people really want support groups, as you know.
Yes. Yes.
So I wanted to just talk a little bit about we're running up against the time because I have so much to ask you. But okay, I just had to have my first scan post remission, and it was so scary. I mean, I stopped sleeping. I got really bad headaches. It was just my friends were a mess, like they were going through it with me. I ended up being fine, but there was kind of a complication. We thought there was. And it was just so hard. And I'm wondering, does that get better ever? Do you have any advice? Because you've been through this a lot, as to how we can not let this, anxiety take over our lives. Because I mean, I'm going to be checked for 2 years every 3 months. What can I do, Tom, to make it easier?
Well, the question I use when a lot of people say, "What can I do?" I says, "Well, what can you do?" And when it comes to a scan, and my cancer, my bladder cancer, which I just found, I went, okay, well, here are the alternatives. This is what can happen. This is what might happen, not happen. And for me, I need to know. I need to figure out the whole gauntlet of possibilities. But then once I had those in my head, I said, okay, what can you do to affect the results of this? And my answer was nothing. All I could do was pray. And this is where faith comes in. We put out prayer petitions, and I know we had over 200 people say that they were praying for my scan results or the operation results. And I believe that worked. I dodged a bullet when it came to bladder cancer. I have to be checked every 3 months. If I clean, it goes to 6 months. If I clean, then it goes to 12 months. For me, it's part of it is figuring out what I can do to change things or to make an effect. And once you find out something's wrong, there's not much you can do except pray about it.
Yeah.
I don't think I can emphasize that enough.
I love that. And we have been praying back and forth since January,
Yes.
since we found each other. And
that's it.
I also believe in, for me, what works for me, as I'm thinking, oh, wait, I do have an answer for me. I think keeping my train healthy, eating a healthy diet, cancer hostile diet, exercising, meditating every day, prayer, gratitude. What else do we do? A sleep hygiene, getting rid of,
Yes.
Removing toxic people from our lives. There's so many things. It's just exciting to how much control we actually have.
Yeah, and people doubt that they have control. And, it's, for me, meditation and breathing and diversion of attention are integral parts of the process of dealing with the chronic pain on a daily basis. I don't know whether you use this, but I've learned about virtual reality from a study
Yes.
I'm doing at Cedars. And virtual reality, even though I was doing this stuff before, is a reinforcement for me. And it really makes it easier for me to be in control, if that makes sense. People tend to give up. And
Yes.
right now there doesn't seem to be a lot of support when it comes to mind-body connection or doctor-patient connections to help people. But we can help ourselves, and I'm a firm believer in support groups because it helps me. And I've seen people go from crying when they walked into a support group to laughing. And
that's great.
Well, it really is. This is all we can do.
Right. So, okay, we spoke a bit about the gifts. Like, people don't really like it when I use the word gifts when it comes to chronic pain or cancer. Do you want to elaborate on what gifts chronic pain and or cancer gave you?
Yeah, I feel like it was a gift because, as I said, it slowed me down.
Yeah.
It solidified my faith. It solidified my relationship with Mary Ann. It allowed me to find a purpose where I can help people. Uh, I'm more at peace than I was before. Uh, I sure don't like the gift of pain, and I wish I could give it back, but there's no way to return it. Uh, but it's. I think just the biggest thing is it slowed me down to the point where I appreciate life.
I love that answer. That's a great answer. You are such a compassionate person and you care so much. You're so authentic. It's such a delight talking to you.
Thank you.
You're welcome. And I'm wondering where all of your empathy to help others. I mean, you've been doing it your whole life, really. Is that something you were born with? Sorry, everybody, I'm not taking your questions. I'm horrible, but I just have too much to ask you. But is it like a fire within, something you learned?
Actually, I think I have to give my mother credit for the empathy. My mother was a nurse. She started out as a diploma nurse, a program nurse, became an RN, wound up being the assistant dean of the School of Nursing at the University of Virginia. She got 3 degrees. She did this while raising 3 kids on a 1,200-acre farm. And I saw her gift of empathy, whether it was with the animals, whether it was her students, whether it was with the neighbors. She went out of her way to help people. And I guess it's natural having seen that. It's probably nurture rather than nature. But yeah, I can credit my mom. Fantastic woman.
Yeah, I have a fantastic mom too. She has Alzheimer's now, but same thing. I just saw it every day, and you just learn that, and that's beautiful. Who are your heroes? Who inspires you?
Mary Ann.
I guess.
Yeah, she really is. I mean, it's her faith is unrockable. Her love is unrockable. Her dedication is unrockable.
You're gonna make me cry, Tom.
No, she's amazingly beautiful to me.
There? She's there. Can she say hi?
No, she's around the corner, so you'll have to meet her.
Okay. I look forward to it.
Yeah, she's compassionate. It's all those things that I aspire to, and I feel like Mary Ann's the greatest gift I've ever had. So yeah, Mary Ann's my hero.
I think she's your dream girl, Tom. I think
I know she's my dream girl.
Thank you so much, Tom, for everything you do. Thank you for this interview. Thank you for letting me get to know you better. I'm looking forward to working with you more. For Grace, we're going to be doing our Pain Cancer Connection conference, and we'll find many more things to do together. And thank you for all your work. I would say keep it up, and I know you will. We're going to keep you busier than ever, I think.
Sounds good to me.
Okay.
Now, you take care of yourself, okay?
I will take care of myself. Thank you. And thank you for always being there for me. You're such an amazing Rock of Gibraltar support. I mean, thank you.
Thank you.
And I will keep praying. And really, I just can't thank you enough. And I want to thank Camera Roland, my wonderful producer with the Mighty, for keeping things rolling. And thank you, John Garrett, for keeping things rolling here. No technical problems. Everyone's keeping it close. And everyone else, thank you so much for joining us today on the Pain Cancer Connection. I loved this segment. And please come and join me next month, where we will be talking about virtual reality. So we just started talking about it today, and that's going to be a great show as well. So until I see you next, everyone, be very well. Remember to vote. Be very, very safe. And be mighty. Mwah. Love you all, and love to Mary Ann. See you soon.
Thank you.
Bye,
God
everyone.
Bye-bye.
God bless. God bless.